Coombs test and anemia differentiate between immune and non-immune anemia. Mechanism of direct Coombs test. Coombs reagent polyvalent anti-human immunoglobulin are added to RBCS. They detect if RBCS have antigen present on surface, in immune hemolytic causes. Later monovalent antihuman immunoglobulin added to specify further. Mechanism of indirect Coombs test. It finds out about antibodies in circulation. Not reliable. Which monovalent antihuman immunoglobulin are used to further specify type of immune hemolytic anemia? Anti-Ig, anti-C3d. Anti-Ig, anti-C3d status for warm antibody AIHA. Anti-Ig positive, anti-C3d plus. Anti-Ig, anti-C3d status for cold antibody AIHA. Anti-Ig negative, anti-C3d positive. Anti-Ig, anti-C3d status for drug-induced AIHA. Anti-C3d positive, anti-Ig positive. Coombs test can be false positive when in multiple blood transfusion. Immunoglobulin involved in temperature in warm antibody AIHA. Ig, 37 degrees. Etiology of warm antibody AIHA. 1.50% idiopathic. 2. SLE, Chia, HIV. 3. Autoimmune, RA, IBD. 4. Drugs. Drugs causing warm antibody AIHA. 1. Cephalosporins, drug-dependent. 2. Alpha-methyl-dopa, drug-independent, features even after stopping drug. Pathogenesis of warm antibody AIHA. Splenic macrophages has receptors for Fc portion of RBCS. So, pan-agglutination. So, extravascular hemolysis. Clinical features in warm body AIHA. Anemia, spherocytosis, reticulocytosis, splenomegaly, jaundice, urobilinogen present. Peripheral smear for warm antibody AIHA. Schistocytes fragmented RBCS or helmet RBC. Reticulocytes on supravital stain. Polychromatic RBCS. Spherocytes. Immunoglobulin involved in temperature in cold antibody AIHA. IgM, 0 to 4 degrees. Etiology of cold antibody AIHA. 1. Idiopathic. 2. Waldenstrom macroglobulinemia. 3. Lymphoma. 4. Infections, EBV, infectious mononucleosis, CMV, mycoplasma pneumonia. 5. Drugs. Drugs causing cold antibody AIHA. Lenalidomide. Which among the two is rapidly progressive, warm antibody AIHA or cold antibody AIHA? Warm antibody AIHA. Pathogenesis of cold antibody AIHA. RBC agglutination in peripheral circulation or extremities with IgM happens. And it's recognized by Kupffe cells, hence extravascular hemolysis happens. RBC destruction site in warm and cold antibody. In warm, spleen. In cold, liver. Clinical features in cold body AIHA. Acrocyanosis. Cold painful blue antibodies. Peripheral smear for cold antibody AIHA. Agglutinated RBCS. Treatment for warm antibody AIHA. Steroid. Rituximab. In relapse, rituximab plus cyclophosphamide plus mycophenolate mofetil. Splenectomy. Treatment for cold antibody AIHA. Rituximab. Avoid cold exposure. No use of steroids and splenectomy. Evans syndrome. Warm antibody AIHA plus. Thrombocytopenia plus. Common variable immunodeficiency. Conditions where spherocytes can be seen. Hereditary spherocytosis. G6PD deficiency. Transfusion reaction. Cuso-4 poisoning. C3b activation happens in cold agglutinin disease. Paroxysmal cold hemoglobinuria pathogenesis. Polyclonal Ig antibodies bind to P antigen of RBCS at 4 degrees and intravascular hemolysis happens at 37 degrees. It's acute condition. Paroxysmal cold hemoglobinuria. Coombs test positive or negative? Coombs positive. Paroxysmal cold hemoglobinuria. Peripheral smear findings. Features of both warm and cold antibody AIHA seen. Paroxysmal cold hemoglobinuria associated with what disease? Tertiary syphilis. Which drugs induce hemolysis by antibody mechanism? Methyldopa M.C. Procainamide, penicillin, cephalosporins, lenalidomide. Which drugs induce hemolysis by immune complex mechanism? Quinidine, rifampicin, isoniazid. Which drugs induce hemolysis by adsorption mechanism? High-dose penicillin extravascular.